I'm Dr. Chinmay Kulkarni. I'm a psychiatrist practicing in Mumbai Psychiatric Clinics, Powai. So today I'm going to talk about depression in at workplace. Usually, what happens is that there are some of the known symptoms of depression are sadness of mood, crying, feelings of hopelessness, helplessness, worthlessness, or suicidal ideas. And most of the people think that this only is the depression, but it is not so. Depression has some other factors which we call as cognitive symptoms of depression, which means that a person has trouble in his cognitive abilities because of the depression, and so that person, and that affects directly to his performance at his workplace or in his education. So a report by World Health Organization has found out that the financial impact of depression is $1 trillion per year. Now that's a huge amount, and a lot of this financial impact comes because of the lost productivity at workplace due to depression. So very often we find out that in our clinical practice we find out many people who come to us and say that we have trouble in concentrating, or we have trouble in memorizing, we are not able to take good decisions like we used to do earlier, or there is lost creativity there are some creative branches like advertising or music, and people come and complain to us that we are not able to do the work which we used to do earlier very easily. And sometimes there is easy distractibility, so the person is not able to focus at his work for a long time, so he or she gets easily distracted. And all these things are very important for one to excel in his work. And depression can affect many of these factors. So there is one thing which is called as absenteeism. That means that the person, because of his illness, doesn't go to work. But there is a bigger problem which is called as presenteeism. That means that the person is going to his work but is not able to function according to his capabilities. So earlier, for example, he used to finish a job in 2 days. Now he is taking 5 days to finish the same job. So he is like a working wounded. And it has been found out that almost 79% of lost productivity is due to presenteeism. That means that the person is going to his work but he is not able to function according to his capability. So it is very important that a person should know that if he is not able to concentrate, if he is having problems in memorizing, if he is not able to take decisions like he or she used to take earlier, or if that person is having trouble in problem solving, or he or she is finding out that he has lost his creative abilities, then if these symptoms are there, then that person should seek a mental health professional and rule out any possible depression. It has been found out that it is found out that depression treatment can improve the work productivity by almost 90%. So it is quite clear, and we have very good ways in treating depression as far as medicines are concerned, or as far as behavior therapies are concerned. And these things do work, and it has been found out in multiple research papers that the treatment of depression do work. And after taking the treatment, the people start functioning much better than when they were in depression. So it is always better to have a workplace which is open about these problems. Usually there is a lot of stigma attached to depression or any mental health issue at workplace, and that's why the people will not come out and people will not speak about these things at the workplace. But the workplaces should be more open about them, so that people will be able to discuss these things and get help from these things, and in the end, if any person is functioning better, then that is always good for everyone else. So last point I would like to make is that if you find that you are having some of these symptoms, cognitive symptoms, along with the other classical symptoms of depression like sadness, lack of motivation, lack of pleasure, feelings of regret, guilt, hopelessness, helplessness, worthlessness, sleep disturbances, or suicidal ideas, or if you only have these cognitive symptoms, still you should seek help and get better after taking treatment of depression. Usually what happens is that people know that they are having these symptoms, people know that they are probably suffering from depression, but they don't think that they should go and seek help for that because of the stigma attached to it. But not trying to solve any problem or keeping the problems just like they are will never solve them. Rather, not addressing the problem may increase the problem. So that's why it is always better to seek help and try to find solutions of the problems you have. And it is always wise for any person to seek solutions, seek treatment for any illnesses. Just like any person, usually people will seek help for their physical illnesses like diabetes, BP, or heart problems. Similarly, depression, anxiety, or other mental health problems are also having biological origins, and that's why it is always wise to seek help rather than suffer in silence.